Some jobs are in the service profession, such as servers, entrepreneurs, seasonal workers, and many people who work part-time and insurance is not offered. These workers help to make us all have a better quality of life. They deserve the dignity of quality medical care. It should not be a luxury that only some people get.
Walter Cronkite, an iconic American broadcast journalist, once said, "America's healthcare system is neither healthy, caring, nor a system." So how did America get here? The answer is simple. America as a whole is unhealthy. So the country's problem can be looked at two different ways. Either the people's unhealthy habits caused healthcare quality to decline, or the people's lack of healthcare caused their unhealthy habits. Every day, millions of people with diverse backgrounds and different lives come to hospitals or clinical offices to receive care. Although these people might not have similar financial situations or jobs that support their healthcare needs, they deserve equal assistance. The Affordable Care Act was the largest step America has ever made towards better healthcare. It gave 9 million Americans health insurance and started placing more funding into clinical practices. This graph shows how much the uninsured population has decreased since health reform. This graph also predicts that 33 million Americans who were once insured will have coverage in 2022. Fast food and technology have given Americans excuses to ignore their health. It's easier to go through the drive-thru at McDonald's instead of cooking a healthy meal, or to scroll through social media instead of going to the gym or for a run. Some experts have referred to clinical medicine as the foundation of medical care, but there seems to be a shortage of doctors in the clinical field. These doctors do not get paid as well and are forced to see around 30 patients a day. They cannot give their patients the attention and care they need.
Almost every study says that the doctor that has the greatest impact on your health in general, the greatest impact on the health of a population, is primary care doctors. We need primary care doctors.
Even before providing the countless uninsured Americans health care, the country spent over $2.8 trillion on health care in 2012. Today, Americans think of medications as the solutions to health problems. Instead of changing diet or exercise habits, patients are prescribed medications to cover up their symptoms for diseases like hypertension and heart disease. Patients buy these medications over and over because the problem is not being fixed. These continuous purchases drive up spending in the healthcare system.
We spend so much time in medicine mopping up the floor around the sink that's overflowing without also turning off the faucet. If we just literally or figuratively bypass the problem with angioplasties and stents or lifetimes of drugs or other kinds of interventions, then more often than not, the same problem comes back again. But what we're finding is that if we turn off the faucet, if we treat the underlying causes, which to a large degree are not so much our genes but our lifestyle, that our bodies have a remarkable capacity to begin healing themselves. And these chronic diseases can not only be prevented but even reversed much more quickly than we had once realized.
If these problems are left unfixed, the medical system will continue to decline, along with America's health. In order to prevent more damage to the system, communities should come together and commit to leading healthier lives, doing things like 5Ks and growing gardens with healthy foods. If America works together, the healthcare system can be restored.